Good evening, everyone. Thanks for having me here. I'm pleased to be here as well with a great panel of folks that I consider experts in this field. I want to start and try to give a little bit of context from a youth prevention perspective. And Peter introduced the organization. I'll tell you a little bit more, but I want to give you some context using some data and pretty recent data to help us get a sense of the scope of the issue. And what I would really say is, as you look at this data, I would couch it as that we are talking about issues of hope and concern that you'll see throughout these data points. There are elements of real hope in it, and there are absolutely elements of concern that go with some of the data points of what we're seeing and what our youth are facing in today's world. The first of which, you may not be able to read that kind of light blue on the screen, but this is a data point from the National Institute of Drug Abuse in which 90% of addictions start in the teenage years. And I say that meaning they don't necessarily manifest themselves in those years, but the roots of those addictions that may take place later in life really form during those teenage years. And I think one of the major things that can account for that is the adolescent developing brain that really isn't fully developed until the age of about 25. We have one of the actual great experts in Dr. Thurstone here that could tell you the real detail that I can't in terms of the brain science. But this is hard science. And it's something that our youth really respond to. But it's important to know that these are a time period of great opportunity, incredible development that takes place in the adolescent years, but also it comes with that an incredible risk as well, depending on the choices that our youth make. So kind of framing that discussion. So our organization, as Peter alluded to, we're really focused on empowering youth and giving them the skills and the tools to make healthy choices. Our organization grew out of the Colorado Meth Project, as Peter referred to. That organization, I'm pleased to say, is still going. You and I don't see it very much like the billboard and advertising campaign that took place from around 2009, 2011, pretty heavily. Our youth still see it in online advertising, and so there's still pretty strong awareness of the campaign and the Not Even Once message that goes with it. We've expanded in 2014 to really expand our focus, taking what we learned about communicating with youth around the issue of meth prevention and expanding that more broadly. We saw a major issue taking place, and it's the opioid epidemic that we are all really trying to come to grips with and seeing on a regular basis in our news broadcasts and in our communities. So that was something that we really wanted to try to take on and specifically address, and we'll tell you a little bit about how we're doing some of that. And then also really broaden our message to include what can we encourage, what positive messaging can we instill in our youth about the healthy choices that most youth really do make, and we'll talk about that in a little bit as well. So in terms of, I want to help you define prevention the way that we as an organization see it. And the work that we're doing, there's lots of elements of prevention and things that are preventive steps that are helping us, but what we're really focused on is primary prevention, and what it is that we hope that we are instilling in our youth is strategies that really take place at the broader community and societal cultural levels. So a lot of that through messaging. Youth see us and interact with us on digital media and social media, a place where there's a lot of influences, both positive and negative. And we want to be a source for some legitimate, trusted information about substance use. What we're hoping to do is impart some knowledge, increase and measurably impact their knowledge on a variety of topics. Brent mentioned the teen brain science, mental health and promoting good mental health, appropriate, inappropriate use of substances that are legal, like prescription drugs. We want to teach some skills, whether that's skills about how to navigate a very, very difficult social media climate, building those media literacy skills, whether healthy decision-making, refusal skills. Some of these things we do through our digital and social media communication, but some of it we do through the youth-serving organizations that we work with at a community level to try to get the interaction that they have directly with young people at a face-to-face level and give them some of the tools to help their young people make these good choices. And ultimately, if we increase knowledge and skills, then we have the opportunity to impact and shape attitudes. And if we're impacting and positively shaping attitudes among youth, that might increase their perception of harm or risk of using a substance, whether it's meth or misuse of prescription drugs or whatever the substance is. If we're able to do that, then over time the idea is that we can change behavior and that we can impact making those actual decisions whether to use or not to use. And as I said, we do this through communications. We also do it through peer engagement. So we work with youth. We have a teen advisory council made up of young people in middle school and high school from across the state that work with us as real peer advocates and educators in their own communities. And then we work with youth-serving partner organizations. So I'll give you a sense of how we work with some of the communities. And this particular slide describes our work on prescription drug abuse prevention across the state. We created what we call a Colorado Constellation Project and worked with and selected 9 different communities that were high risk and had significant challenges on the prescription drug front from a variety of different data points, and then worked with communities also where we found partner organizations that wanted to engage in this work with us, whether they were already doing it or whether it was something that they wanted to start. And so we helped to support some of these communities. So it's really taking some statewide resources that we as an organization have, that we partner with another statewide entity called the Colorado Consortium on Prescription Drug Abuse Prevention that really takes a holistic approach in impacting the issues of prescription drug misuse and addiction. As you may know, if we were to talk more specifically about that, it is really a multifaceted challenge that we're up against with this opioid epidemic. It requires youth prevention. It requires every other step of the process. It requires the support of law enforcement. We work around treatment, recovery, preventing, creating safe disposal options. I could go on in terms of the different ways that we have to impact that particular issue in order to have success in changing the landscape for our citizens in Colorado. So that's a little bit of how we've organized our work, particularly around prescription drugs. I want to share some data with you specific to Colorado that I think, again, you'll find some areas of hope and some of concern. We've been working on this prescription drug issue for about 4 years as an organization, and that was about a year before that was when our governor set out a plan for trying to reduce prescription drug misuse amongst folks that were 12 and over. He wanted to see if we could cut that number by about 92,000 citizens that were misusing prescription drugs. And I'll tell you that we're not there yet. We are seeing some positive shifts in that trend, however. From a youth perspective specifically, the first bullet point there we're looking at, we have seen a significant decline in the use of prescription pain relievers among high schoolers. This is data from the Healthy Kids Colorado survey. This is fresh data, and it's an enormous sample size, more than 40,000, I believe, of our high school youth that were surveyed across the state in late 2017. This data came out this summer. It's down 24% from where it was in 2015. That's good news that we're making a statistically significant change in use among our youth. And I think going with that, one of the things that we really look at from a prevention perspective is the fact that if we can increase perception of risk of using a drug, that typically will result over time in a decrease in the actual use. And that's one of the things that we've seen in time period between 2016 and 2018, where the perception of youth that saw great risk in misusing a prescription pain reliever, so we're talking about Oxycontin, Vicodin, Percocet, oxycodone, those types of substances, that increased 35% during that 2-year period. That was a significant spike the right way, the way we wanted it. And so we're seeing that move in the right direction. And I have to think the amount of press coverage and conversation that's taken place about the issue and all of the lives that have been impacted has had a positive impact on our youth. we've seen that in our survey that we took this from, we've seen that significantly more youth recognize that prescription pain relievers are just as dangerous and addictive as street drugs, specifically heroin. These are synthetic forms of heroin, and we need to treat them as such that if they're not prescribed for you, there is significant risk that can occur. And we're also pleased that through some of the campaign work that we've done, that we saw that youth who are aware of the campaigns and the messaging that we do are less curious to misuse prescription drugs and more likely to discourage their friends from using. And so that positive peer influence is a real thing and can be a positive factor. A few other data points on other substances that I thought I would share as well that coming from this recent data. We referenced meth and our work with the Meth Project. There's good news on that front among youth, despite the fact that this drug, and I think Jeff alluded to it earlier, the fact that the overdose deaths are up for methamphetamine. It continues to be readily available, highly addictive, and now even more deadly than it has been previously. Teen meth use is actually going in the right direction. It's gone down. It's down to 2% of youth in this Healthy Kids Survey report that they've actually used meth in their lifetime. That's half of what it was when we started the Meth Project back in 2009. So we've seen a real positive shift and trending downward, that youth are getting the message and making a good choice despite the fact that this is out there and continuing to create trouble for adults. So that's good news that we can take from this. Marijuana obviously continues to be a challenge for us. And despite the fact that that use remains stable, multiple data sources have shown that despite during the time since legalization, use amongst teens is stable. However, it's still among the top 5 in the nation. No matter how you slice the data, we still rank in the very top among use for marijuana among youth. And the other concerning factor is because this is being normalized amongst adults, that the perception of risk continues to fall in using marijuana. We're down only 60% see great risk in regular use of marijuana. That was down from 71% in 2016. That portends that we could have concerns moving forward because of this normative behavior. And the other thing that really concerns us is the age in which people start using. Half of the folks that responded in this survey said they first tried it when they were between 12 and 14. And if we talk to Dr. Thurstone about the age of first use and the impact, the earlier you start with substances, the greater the risk of addiction that takes place. And that's one of the things that really concerns us. Finally, to wrap up on some of this data, family discussions around some substances like prescription drugs is increasing. There's more dialogue amongst parents and youth, and we talk about the parent element of this conversation. That's good. It's up to from 32% to 51% today, but it's not enough. We're still not having that conversation at the rate that we are about alcohol and marijuana. And Jeff referenced the conversation that so many of us as parents of teenagers have about drunk driving, and the fact is that there are twice as many overdose deaths as there are drunk driving fatalities. And yet, we talk a lot, and rightly so, about drunk driving, but we're not having enough of these conversations with our youth about the risks of overdose from substances like prescription pain relievers. So I would tell you the timing of when we're doing this prevention work is critical. That data point about marijuana tells us we've got to be in middle schools having these conversations and talking with our young people when they're middle school age, because we want them to be prepared for the transition that takes place when they go to high school. That's one of the biggest risk periods, when the access and the curiosity increase, offers to use substances, and the actual use themselves, all those double in that time period of that transition year of 14 to 15. So we want to change those misperceptions. So one of the things that we're currently working on as an organization is really focusing on some positive social norms. So the data point that you'll see that on the football jerseys and next to it is we're trying to emphasize the fact that most teens are making good choices when it comes to substance use, and emphasizing the positive norms instead of emphasizing the negative of how many youth are using. We want youth to feel comfortable that they don't have to succumb to peer pressure to use, because the vast majority of their peers are not. Whatever the substance is, whether it's alcohol, marijuana, prescription drugs, they're not using, and we want them to have that strength of knowing the positive statistics that really most aren't using, and really to stick to their convictions to make those good choices. So one of the attempt with this campaign is, can we close the gap between what teens perceive, that everybody's doing it mentality, and can we get less youth to overestimate use amongst their peers, so that we can bring that back in line with what the reported use actually is. And if so, over time, that's been proven to have an impact on use amongst youth. And the good news is that we're starting to see some of those trends already. We've been at this campaign for about a year, and some of the early data that we're seeing is significantly fewer middle school students are overestimating use amongst their peers. That's good news. It's amazing the number of youth that misperceive use. Every substance except marijuana that's taking place, and I think we probably know why some of the challenges with marijuana exist. So that's something that we're pleased about. So we can talk more about any of those questions, but I wanted to leave you, just before we pass it off to Dr. Thurstone, some resources, and he's going to talk about more specific resources for you, but there are a variety of different places that folks can get help. It's not the work necessarily of our organizations, but there's a number of partner organizations. Speak Now has a website that's built for parents to get answers on how to have the conversation on whatever the subject is. It's age appropriate depending on the age of your young person, so that they can have those conversations. There's obviously crisis services resources as well. We partner with a national organization, the Partnership for Drug-Free Kids, that has counseling to help parents navigate when they think their son or daughter may be using, and how to get help at the stage that they're at. So there are a variety of different resources out there that I would encourage you to seek out to help increase those conversations.